Ladies, imagine if you will, you're in your late 50s and you're going through the signs and symptoms of menopause. And you're over 100 pounds overweight. Everyone that loves you is trying to tell you you need to lose the weight. You followed their resources and you thought they were futile, so you decided to go on your own terms. Later you would discover you're hemorrhaging for 1 year continuously. Later you'd feel pain in your lower lumbar and your right leg was growing numb. Sharing this with your husband, not being a doctor, he informs you you might be experiencing the symptoms of cancer. You were too frightened, so you confided in a friend, and she suggests you should see your obstetrician. There, the obstetrician had confirmed it. You have endometrial cancer. There are many types of cancer. However, I'm focusing on endometrial because I've done my research through medical doctors and journals. I've been through universities here in San Diego and elsewhere, as well from my own personal experience. I'll be talking about the risk factors, the treatments and solutions, as well as the mortalities and survival rates. Let's discuss what are the leading types of causes of this type of cancer. First and foremost, what is endometrial cancer? It is cancer of the womb, uterus. And it occurs in women between the ages of 55 and 70 years of age due to excess amounts of estrogen and body fat. Obesity, being overweight, is a very strong factor, as you can see here. And fatty tissues change normal body chemicals into estrogen, which can promote endometrial cancer, according to Drs. Leah Cherta and Belinda Rowland from Yale Encyclopedia of Medicine. Now you can see that obesity is the leading causes of cancer, and I will discuss what to look for in ways of treating this type of cancers. Well, the risks include taking tamoxifen to treat or prevent breast cancer, family history, starting menopause after the age of 50, menstruating before the age of 12, obesity and diabetes, personal family history. Well, as you can see, there are many risk factors relating to endometrial cancer, but the number one risk is obesity. People think we can eat anything and everything we want. Here's an example. But little did we women know that if we eat this stuff, it would be unhealthy. We wouldn't follow the food triangle. And if we didn't, we'd be off balance. And what the doctors have failed to tell us is how not eating healthy would affect our bodies. Just imagine, we eat this stuff every day, that fast foods. But look at the fats and grams of fat and calories we digest on a daily basis. Now that you're aware of how obesity can lead to endometrial cancer, here are some signs and symptoms of this horrible disease. You can see unexpected vaginal bleeding after menopause is one of the big key symptoms. Also includes pain when urinating or having sexual intercourse, pelvic mass and pain there, and unexplained weight loss. Here's the treatments and solutions. Stage 1 of this cancer, you perform a biopsy with an ultrasound to locate the tumor, to perform surgery to remove it, followed by radiation. Stage 2, have a hysterectomy along with radiation. Stage 3, remove the vagina along with radiation and chemo. And stage 4, remove the whole endometrium along with radiation and chemo. I gave you hope, but unfortunately there is bad news. There's at least 4th most common cancer in American women, and 34,000 cases alone, and 6,000 deaths since 1996. Funny thing is, it's the most curable type of cancer. In conclusion, here's the survival rates. For Caucasian women, it's 86.2, and blacks, it's 61.8%. Here are the top cancers, as you can see: breast, and endometrial are to the top two. In conclusion, a woman named Charlotte here, she died on March 26, 1997, at the age of 62 from endometrial cancer. When the oncologist couldn't figure out what was the leading cause of her death, this is why I'm informing you. I'm not trying to persuade you. I'm only here to educate you about this horrible disease. You're all probably wondering, who was Charlotte? Well, she was a mom, a wife, a daughter, an aunt, a sister, and a grandmother. Charlotte didn't think she would die of something that was something preventable. And I'm also here to tell you that Charlotte was my mother. Thank you.